In this surgery, it's patient number Amanda Matthews, and it is an open brainstem activation and an open brain bleed craniotomy. Before I started the video, I had separated two lobes, like here shown in the video, and I had put in with a Neuro needle 2 of the activation drugs. After 3 doses of each of the drugs, I got some brain activity, and then I used silk staples like here and attached nerve to nerve, and I just did a small incision above each one. Then, as you see here, I'm indicating how I went from nerve to nerve, nerve to nerve, nerve to nerve, nerve to nerve. And it's important that you surgically do every nerve to nerve. So it involves no brain and more abnormalities. Then after brain activation, after it is a man-induced coma, there will be 1, 2, 3 brain bleeds. I initially saw one after a nerve buildup and red tissue formed. I used spacers and a plunger, and I unclogged the nerves, and I plugged it with a 0.8 plug clip, shown here. I indicated that there was a brain bleed there was a nerve buildup, and there was a brain bleed up here. There was also one right next to the sciatic nerve. This can cause complications because the sciatic nerve can sometimes be linked to speech. I took this instrument and I did a small incision. As you can see that there is some brain blood there. I then took spacers. Well, no, actually. I then took some sponge and clogged up the brain blood there because suction can be dangerous around nerves, and if you suction up a nerve, it can be potentially fatal. So I suctioned up all the remaining brain blood as best as possible. Okay, I then took some spacers. This is like the most common neuro device, and I just spaced apart the brain. I have then here, as you can see, and then after I had spaced the brain, I just took both instruments and I just poked and dotted, poked and dotted, poked and spaced. And then you can either do a neuro CT right here and see where you are. You can do a navigational system, or you can just do it by feel. When you feel a hard nerve develop, then there it is. It was an easy feel for me. So I just proceeded then to prepare my clip plug, and I was then going to first I was going to irrigate the wound for easy closure and for easy plug. I then took my instrument and I unclogged the nerve buildup, and it's starting to bleed, and I quickly clogged it with the 0.8 millimeter clip. This stopped blood flow, and it's helped regrow brain tissue. I then irrigated the plug, and this provides a smoother, less rigid entrance into the back lobe. And I just continued to irrigate and all around the brain, because it's very important to keep the brain hydrated. Now, proceeding to the next brain bleed was a little bit more challenging because I knew it was in the sciatic nerve. So instead, I retook the staples out, as seen here, and I opened up the 2 lobes again. I irrigated, suctioned, I suctioned here, just getting at all the brain fluids, and there you can see the brain stem is just right there. I then took a new thing of spacers because I'm going to need to use the curves for an angled thing around the brain stem. I situated the curved spacers in, and then I situated the spacers in good, and the other spacers provide a more open space. Then I used the curve and I got around the brain stem here, and I had isolated the brain stem nerve buildup. See here, I cut off. Oh no. I accidentally knocked down the navigational system. It was no big deal. Just that I knocked down the software program, but it's just a quick situation. I just had to plug in another wire. Anyways, so I cut. The 0.9 clip, and I just put it down the angled spacer, and I got it into where the blood was originating from the brain bleed, as seen here. I then took some sponge. I hydrated the sponge, coiled it up, and put it in where we are missing the brain matter now. I then close the two nerves up, and I add 30 cc's of potassium into the brain, and this provides a mellow and gives all the nerves in the brain a stimuli. Then I made sure the two lobes were bundled as I took the surgical stapler, as my hand is unfortunately covering it. I took the surgical stapler and I stapled the two lobes together. I then took an instrument that provides the lobes a little bit more air. Indeed, as the stapler can appear to be crushing the lobes. Then I took some sponge and filled in where the lobe was accidentally pushed down. This will give the lobe stability and help the brain muscle regrow, and the sponge will just dissolve after a neocridin, which is the acetic acid, regrows back. So I added the sponge, like seen here, and just made sure that the sponge was in good enough. I got some irrigation, and I irrigated suitably. And irrigation is good for the brain because it hydrates the main lobe, and without the brain needs to be hydrated because this provides incredibly nerve function. As you can see here, I'm just overlapping the brain with irrigation and letting all the irrigation go into the brain that's going to get in. And I suctioned up the stuff that was not getting in, like seen here. I patted the brain, making sure it was suitable. And then it was time to reattach the piece of scalp, like I indicated in the camera. I put the scalp back on the hepatoba, took the surgical staple, and I just did a box of staples completely around the brain, as seen here. Now, this is going to create somewhat of a bubble on the scalp, but that doesn't create any thread. It actually is good because it gives the brain some area to swell if it gets a traumatic accident and ever needs to swell. I lay down the surgical stapler and I indicate to the camera that all the staples are done. I then irrigate a little bit of water on each of the staples to provide a little better ease into the medulla, because it can create an infection because but not in this case. Staples are more reliable than sutures, and this was a very delicate case. I then took up a piece of bandage, and as seen here, I irrigate the bandage, and this releases a paste from the bandage that goes over up and does let hair go in. So as hair grows, the bandage actually weakens and will eventually deteriorate. I'm patting down the brain, seen here, and creating a smooth and stable bandage as I get ready to pack the brain and deliver the patient back to the recovery room. Now, we need to do a full neuro workup to see if there is any brain bleeds in that section of the brain or in this section of the brain. And surgery is complete.